Minister, I just have 3 or 4 brief questions and I'd appreciate a response. I'll just take 1 minute and leave you the remaining minute and a half I think I have. Minister, can I ask you about the new portal for vaccinations? Given the alleged difficulties with the portal up to now, can you clarify details about the veracity of the new portal? Will people's PPS numbers be used as an identifier? The second question, Minister, can I ask is in relation to the required legislation or statutory instrument to be brought in relation to children's shoes. Can the Minister clarify when this change will be brought in? The next one, can you outline what contact Junior Department have had with community pharmacists in terms of informing them of their upcoming role in vaccination rollout? And finally, can I just inquire about people with underlying conditions who are aged 16 and under, people with Down syndrome, for example? Has any consideration been given to those people and, I suppose, to their parents who are their primary carers, given that, I suppose, they, by their very nature, they have children under 16, the parents themselves would be young enough, and just, I suppose, has any consideration been given to them in terms of vaccine rollout? Thank you.
Minister, just under a minute.
Thank you, Laskin Corlin, and I thank the Deputy for his questions. With regards to children and vaccinations, there is ongoing work, there are ongoing clinical trials. As Professor Butler said yesterday, the vaccines are not currently authorised for children, but the clinical trials go on. If the EMA looks at that data and authorises them for children, then that is something that NIAC and our own agencies would look to see if it can be implemented here. With regard to pharmacists are going to play a key role in the vaccination programme, particularly in the coming months as we scale up. So pharmacists, there is a deal in place with the IPU right now in terms of pharmacists vaccinating on their own premises and indeed working in the vaccination centres. I would envisage the pharmacists coming online more and more as capacity is ramped up. So, for example, as we move into the age cohorts, the sense is that on the underlying condition cohorts, that's cohort 4.
Thank you, Minister. I know it's unsatisfactory, but